Crisis Connections is a critical safety net in King County, and now we are expanding statewide. So we are a hub for information, resources, and support for people who are in crisis, but also we can provide resources and support for prevention, so to help prevent the next crisis, as well as support after the crisis has occurred.
211 is an information and referral services where we look up resources for the client. It could be any kind of tangible needs, housing. You have gotten a new place, you've already moved into your own place, and you're finding yourself short in food, or you've noticed that you don't have food at all. So you always can call 211 and they will be able to provide you with resources that may be able to help you with food banks, pantries, and any other resources that you may need. So you can focus on other parts of your life.
Some topics rate from individuals being lonely and just wanting someone to talk to. Some topics rate from high acuity, so suicide or self-harm or homicidal intent. Other topics are more like young adults who are in college and they're stressed out and they don't really know how to maneuver. Some people just moved here and they, because of COVID, haven't really been able to get out and about. So it's a variety of calls.
And TeenLink is a support and resources for youth going through mental health challenges. And so what's great about this program is that the volunteers that are answering the phone are youth themselves. And so if the teen or the youth doesn't feel okay talking to their adults in their life, then they're able to call and get some support and resources around whatever they might be feeling at the moment.
I lead a team of opioid recovery specialists as we help support the state of Washington in helping people find access to medications who are battling opioid addiction. I also help to oversee the day-to-day operations of the Washington Recovery Helpline. We're a 24/7 phone service offering support for folks who are calling about substance use disorder issues, problem gambling, and mental health. We also have a benefits access line that can help people apply for DSHS services as well. But our most typical call would be walking someone through how they can get into substance use treatment. If you are a family member, feel free to refer someone to the Washington Recovery Helpline anytime.
There is the CC Cares, which is like a care package for individuals who've lost someone. You can sign up on the Crisis Connections website, or you can call the crisis line and they can help you sign up. And really it's a care package from other people who have gone through losing a loved one.
It's all geared towards the survivor grief as it pertains to suicide. So I have a book that's very specific to that kind of grief. I have a journal for them to write in. That can be very helpful. I have a mug and some tea, some chocolate and Kleenex and books that might be useful for them when they're ready to read. Suicide is a very specific type of grief. It holds people by the throat. It is a trauma and a complex grief all on its own.
Think of the continuum of crisis as a circle. We have the moment of intervention, so in the moment of crisis, we're there, we can support them. And then after the crisis, when the trauma after the event, we provide support. And that support will take you hopefully to help you for the next crisis.
It can be uncomfortable. Sometimes talking to a stranger is weird. And sometimes it's weird to kind of just tell your soul to someone who doesn't know you, but everyone here wants the best for you and wants to work with you and move through whatever you're going through to the best of their abilities. So, you know, it may be uncomfortable at first, but I guarantee you that it's worth calling.
We like to meet them where they're at, and oftentimes folks who call our line, even for the first time, have some idea of what they're interested in doing, and then we kind of walk through the feasibility of that and try to put in a plan A, a plan B, and a plan C.
We're 24/7, 365, and anyone can call, day or night. Whatever crisis they are, it's self-defined. We never define a crisis for anyone. So you can call if you're having stressed out from a bad day at work all the way to suicidal ideation. And so we handle the whole spectrum of crisis.